I am Janice Bissix. I am a holistic cannabis practitioner and program director for cannabinoid medical sciences at JPU as part of their Master's in Integrative and Functional Medicine program. So here's just a little bit about me. I just like to tell people why a dietitian would be in this field, and that's because of my dad. 6 years ago, he had some very serious pain, and he was given all the traditional pain medications that made him constipated, groggy. He hated them. So finally, after a 3-day hospital stay for constipation as a result of these opioids, I asked his doctor if there was anything else we could do. And I said, what about medical marijuana? And I knew nothing about it. I used to use air quotes when I used the term medical marijuana. And he said, I think that's a great idea. We got my dad certified, went to a dispensary, came home, he tried it. He was in excruciating pain. He stood up, said, I'm going to go take a nap. And he said, wow. And I said, are you okay? And he said, I'm not in pain. So I left my business of 15 years and went back to school to become a holistic cannabis practitioner. So John Patrick University, it's actually 4 schools: radiological sciences, medical imaging, and we are in the School of Integrative and Functional Medicine. Jana is also on this Zoom. She is a fellow professor at the university and a cannabis nurse. So JPU has accreditation from all the accrediting boards. I won't bore you with all of that. We've gotten lots of awards and recognitions. We have financial aid for students, member of the GI Bill. So our learning environment, our program is 100% online. For the School of Integrative and Functional Medicine. We have 15-week semesters, 3 per year. January, May, September starts. We have weekly live Zoom sessions, and this is one thing that differentiates us from some of other online graduate programs, that we actually have live sessions with our students. The students give presentations, they learn from each other. It's a really great model. This is the dean who popped on, Dr. Dvanowitz. And he's fabulous. He's got all sorts of credentials, and he's a great dean. So our masters in integrative and functional medicine, we have various concentrations. The one that we're involved with is cannabinoid medical sciences, but we have all these other concentrations. This particular program that we're involved with, it's the only one offered in the country where you can get a master's in integrative and functional medicine with the concentration in cannabinoid medical sciences. We also have graduate certificates as well, and a bachelor's in integrative and lifestyle. So here are the core classes within our program: integrative and functional nutrition. We have lifestyle medicine, natural medicine, herbal medicine, etc. A nutrition for mental health, which is certainly important, especially nowadays. So within our concentration, here are some of the classes that you will take in addition to the integrative and functional medicine. We have Dr. Lola, she couldn't be with us tonight. She's a pharmacist. She teaches the phytocannabinoid pharmacology. There are all sorts of, these are the classes that Jana and I teach. Cannabis therapy is my class, and cannabis and CBD product formulations is Jana's class. And she'll be saying a few words in a couple of minutes. Here are some of our faculty in our program. Karina Hoppen, she's a doctor. She came into our program and graduated, and now she heads up the Alzheimer's memory care concentration. So these are the various board exam certification options. So when you graduate from our program, you're eligible for candidacy for these different board certifications. So you can sit for these boards. So you guys on this call all know this. I thought we might have some people who were new to this. You all know the medical uses. You know the history of cannabis and why it was made illegal. You know about the stigma, part of the reason why we have the stigma against cannabis as medicine. You all know about the endocannabinoid system, components of cannabis, so I can just go right through that. This is just giving basic information about the requirements to apply to the program, 3 letters of reference, your CVs, transcripts, etc. And here are some of the prerequisites for our program. Our program is really geared for working adults, geared toward clinicians who are already out there working. We have doctors, we have nurses, we have social workers, we have dietitians, addiction counselors that come into our program. Here are a few alumni from our programs in integrative and functional medicine. I'll go through here. Dennis, I mentioned Karina is now working with the university on our program. Here's Holly, she's a dietitian. She did her master's with a lifestyle medicine concentration. So that's a very, very quick overview of the university. And I'm going to turn it over to Jana, cannabis nurse, to give us a little bit of background.
Of course. And just briefly, my background is I'm a cannabis patient who happens to be a nurse. And after suffering a complete health collapse in 2012, I was actually labeled totally and completely disabled in 2013. And I really credit both cannabis and nutrigenomic approaches for my recovered health. And I am working full-time and then some today, fully functional and, able to do much of what I wasn't able to do a decade ago. So I also credit cannabis with sparing me having to use opioids for chronic pain, which was huge. As we know, as medical professionals, that's a path that we like to avoid. Cannabis has also helped my daughter with autism enormously. And so this is a subject I'm very passionate about. My journey through this cannabis industry has been very organic, and started as a patient, and then a mom to a patient, and then a grower, and then started counseling patients, and then saw the benefit of educating medical professionals because I could reach so many more patients in that same hour teaching a medical professional. So that is now my focus, along with legislative cannabis advocacy. And just the importance of educating medical professionals is so profound, especially in legal states. And one of the legislative advocacy bills that is being introduced to our Oregon 2023 legislative session is going to mandate cannabinoid science education for all medical professionals, CEs or CMEs for licensed, and integration into curricula for medical schools and nursing schools. So we just really see this as necessary for cannabis patients who have had legal access in Oregon for 24 years to be ensured competent and ethical cannabis care by medical professionals. So this is really, coming down the pike, especially those of you on this call who are in Oregon. That's our journey, and really what makes JPU, our program, so unique. I mentor a lot of nurses and some that are in competing programs, is that we really focus on clinical application. This program is taught by clinicians for clinicians. So for my fellow nurses, we teach the critical thinking. We teach how to take all of this theory and apply it to patients in real life. And so I really think that's a big part of what sets us apart. And we also, with the course formats, we can either offer the degree program for somebody who wants a complete master's degree or even a bachelor's degree. And we also allow those that might already have higher degrees or licenses and don't need the full program to come in and take the individual courses, which they can then add college credits to their CV and resume and really level it up and formalize their cannabis education that way. We also offer, and so this is the JPU page for School of Integrative and Functional Medicine. So just want to do a quick review of there's the master's program and the bachelor's program in integrative and functional medicine. And so, it gets into nutritional counseling, integrative and functional nutrition, nutrigenomics, nutrition oncology. You'll see this is a very holistic program. And then this is where we get into, all of these master's degree programs: lifestyle medicine, diet and genes, mental health, nutrition, natural medicine, herbal medicine, nutrition oncology, which is huge. And then analytical chemistry of cannabis, phytocannabinoid pharmacology, cannabis pathology diagnosis and treatment, and cannabinoid science. Those are all the graduate level courses. And then the undergraduate courses, which are also the prerequisites for the master's degree program, is Janice's program, SCI 305, which is cannabis therapy, and mine, SCI 306, which is cannabis and CBD product formulations. So it is a very comprehensive program. It's 30 credits in graduate plus the prereqs of 6 credits. So pretty comprehensive. I also wanted to review our accreditation. So all of our courses are Department of Education approved, and they are good for college credit. This is how we can offer the financing, which is very standard. And so we do have full accreditation, and you can find this on the accreditation page on the JPU website. I also wanted to just discuss, I know Janice talked about the different board certifications that are possible. We also, through our collaboration with the Institute of Cannabinoid Medicine, TIOCM.org, we are offering a diplomate in medical cannabinoid sciences, which is also, any students who complete our degree program are eligible to apply for, and also a fellow of medical cannabinoid sciences. So we have many ways and options for pre-existing medical professionals also to really formalize their education and their ability to serve patients in this realm. And that is really important for nurses. We have the National Council State Boards of Nursing guidelines, which were released in 2018. And one of the requirements in these guidelines, that it's basically a scope of practice for nurses' education of cannabis patients, is that they must be able to exemplify education on the topic before they educate a patient. So I'm assuming this is pretty common in many different medical fields. And it is something that we do need to require, because medical professionals who are not educated about cannabinoid science tend to educate from fear and stigma and misinformation, and even erroneous labels like cannabis use disorder, because they don't understand that if a patient is presenting with subpar outcomes, through a consultation and education session with a competent medical professional, we can often problem solve any of those issues, which a lot of them are around, lessened function and things of that nature. And so sometimes it's just, they need somebody to come in and help them tweak their regimen, and then they no longer meet the criteria for cannabis use disorder. So it really is high impact for our patients as well. So I'll go ahead and do a stop share, and we can do any questions and answers or discussion.
How long have you been teaching this? How many years have you had a specialty in cannabinoid medicine?
I've been teaching since 2020, and I think Jana, you as well, right? So
Yes.
We're in our 3rd year.
Yes, I also had accredited content since starting in 2018, teaching nurses about cannabinoid medicine. So good question. I know we ran through that pretty quickly. Any other questions, Heather or Kayla?
I think you answered my question, because for me, I had questions about financing, and I believe because it's a master's, there's still options for financial aid.
Yes.
Is that okay? But not really grants like you can have for undergrad.
That is probably a Michael question.
Yeah,
Okay.
that's definitely a Michael question. And if you email info@jpu.edu, someone can help you with that, Heather. Yeah.
Okay.
Yeah, and of course, for Cannabis Nurses Network members, there is a 20% JPU tuition discount, so that should help some as well.
Yeah.
I have interns that work with me, and some of my Simmons interns, they're paying, I think, $1,600 per credit. And our credits are $515, and with the 20% discount, it's only $412 per credit, which is pretty among the lowest out there, as far as it's affordable. It's meant to be affordable. It's geared to the working adult. It's clinicians who are out there working, who want to advance their degrees and their knowledge in cannabinoid medical science. So
yeah, I think when I was doing my master's program back in 2013, it was $650 a credit. That was almost a decade ago. So it really is very reasonable. And just FYI, if anybody on the call is interested in getting into the winter term, which starts in January, the deadline to apply is December 15th. So I assume we're going to be repeating this before then, just to reach those that may have not been able to get in because of the tech issues, but
Right.
so you're aware of that. I hope this was a nice little introduction. Kayla, you're awfully quiet. Oh, I was.
I'm here. I just don't have any questions. You pretty much answered everything.
Oh, good. Well, that was our goal. So yay.
Right.
Yeah, I'm good. I'm here.
And if you
Yeah,
think,
Thank you for putting this on.
Of course.
Appreciate
Sure.
it.
Sure. And if you think of questions afterwards, you can reach out to either one of us, jbissex@jpu.edu, jchampagne@jpu.edu.
I'll tell you, as a result of this, I've got a couple of books that I've written, and I'll send them to you. You can take a look at them. One of them was written in 2018, and then there's a new version of that we're going to press next year. And the other one is on history. And I think your students would like them. I think you would like them. I think they're useful and have a lot of good information. And by the way, I'm very impressed with all of the things that you've had to do in order to get these accreditations and to get the faculty that you have.
Thank you.
Yeah, and we do have kind of a recommended reading list of books that aren't necessarily textbooks. So definitely, if you want to text over or email over links to your books, we can certainly review them and consider them for that list. So that'd be great. Thank you.
I might ask a question about prerequisites. And because I looked briefly and I noticed one of the prerequisites is it biochemistry or something that's, for me, I've been a little bit out of that realm of studying science for quite some time. But so is that something like that's offered at JPU and that I'm definitely need to have as a prerequisite, even though I have some other degrees? Okay.
Heather, you probably took biochem back in the day, right? In your training?
I don't think I did. No. So that's why I was kind of looking at it and, I think I'm smart and I can probably do it, but I'm just wondering if that's is that required versus recommended?
It's probably a Michael question.
I was going to say that he's
The
the one that
dean.
reviews the transcripts.
Right.
Okay.
I think with your Bachelor of Science in Nursing, you would start off with just the 2 undergrad prerequisites and go right into the master's would be my guess, but he would have to verify that. So
yeah.
Okay, great. Thanks.
Of course. Oh boy, that was pretty short and sweet.
Yeah.
I reviewed my list. I don't have anything else. Do you, Janice?
No, I don't think so. I think we touched on, the basic things. I sort of skipped through some stuff because the people on this Zoom are pretty knowledgeable about, some of this stuff. So.
Yeah, of course. Well, I imagine we'll be repeating it and hopefully getting, I think Michael said there were 16 people registered. So I'm sure we'll be repeating it again. And so if you guys want to join again for the next group, you certainly can.
May I ask one more question? You
You
said
may
it,
ask
Jana, but
one
I didn't
more.
write it down. Sounds like the program starts in January, and then when's the next term? May?
May.
Okay.
And then September. Yeah.
Okay.
And I know that, Jana said the deadline is December 15th and there's little wiggle room there too. If the dean knows that you're interested and you sort of get your application in, but you're missing a couple of things, you can work on that as long as it's
Okay.
in.
He just needs the application part by 12:15, and then you can go through anything that needs to be added or changed or whatever thereafter. So,
Okay. Thank you.
of course.
Sure.
Yeah, it'd be cool to have you guys in my class, Heather and Kayla. That would be
It would
fun.
be-
I love
Would be
teaching.
fun.
Although I love other medical professionals too. We've had pharmacists and dietitians and psychologists and gosh, who else, Janice? We've had a really big variety of students.
Yes. A social worker I had.
Right.
Yeah, the nurses in the program, they're so awesome.
We just rock.
They're so great. They're so great. I mean, I love my dietitians, I'm not gonna lie, but the nurses, our students, I just love our students. They just come and they're curious. And on the first class, I say to them, you know, you're going to learn from your fellow students, you're going to learn something from your professors, and the professors are going to learn something from you, because they do discussion posts and research studies and go out and find the latest research on, you know, cannabinoid therapy for Crohn's disease. And they submit these papers. And even though, you know, we teach on it, we might say, wow, this is a brand new study I wasn't aware of. So it's very collaborative. And I had a student who said that her fiance was also in an online graduate program. I can't remember which school. And she said he can't believe the difference, because he sits and he listens to this stuff. There's no back and forth. It's just an online graduate degree. And he's responsible for listening to the lectures and doing the quizzes and tests and all, but there's no back and forth. And he sees her like getting on the Zoom call and, you know, talking and really. So she said it just really reiterated to her what a great program this is. So that's always good feedback to hear.
One of the things I wanted to add is I give informal talks at UCSB, and I've been on the faculty there. And I am really impressed with how sophisticated today's college students are in regards to cannabis. The questions that they ask indicate that they understand some of this stuff. So you probably noticed that the people that are coming in are more sophisticated. The foundation that they're on is a little bit higher than it was, you know, only a couple of years ago.
Yes. Bless you, Heather. Yeah, absolutely. And of course, you know, still now, David, medical schools, only what, 20% teach about medical cannabis and the endocannabinoid system. How can that be?
It's only the largest neurotransmitter system in the human body.
Right?
Mhm.
It's mind-blowing. It's mind-blowing that they're not, that's such a disservice to patients, but
Everyone.
to the doctors. It really is. I understand, you know, older doctors who weren't, I mean, I wasn't trained in it. I don't think, Jana, you weren't trained in it no. So, I mean, I understand that they were not trained in it. However, you have to be living under a rock to not realize that people are using this medicine. They're using this plant as medicine. And it's really incumbent on you as a practitioner to at least know something about it. At least not say, I don't think that's a good idea for my 85-year-old patient because I don't know, I don't think it's a good idea. That's what people say. That's what doctors say to people with pain in their 80s. Oh, well, I just don't think that's a good idea. Really? Why? What are you basing that on? It's the stigma that has perpetuated over the decades. And I get it because I was there. I didn't understand. So our goal, I mean, Janet and I are very passionate about educating healthcare professionals because we got to get the word out there, and we have to be ready when it becomes federally legal, descheduled and legal and available. I mean, I've worked with breast cancer patients in Georgia. No access to medical cannabis. They're undergoing chemotherapy and they have to illegally get cannabis to help with their symptoms and their side effects. That's not right.
Yep.
And medical professionals, like how I learned about cannabis was I had some really profound health outcomes, including complete reversal of autoimmune lupus on my labs within a year of starting cannabis therapy. And as a nurse, it was like, wow, how is that possible?
Right.
I dove into the research myself and I've read thousands of research studies and then saw the benefits in my daughter and worked with thousands of patients. And you really come to a point where you realize medical professionals who aren't taught cannabinoid science are not upholding They're basic ethical oaths to patients, like doctors do no harm. Well, that entails a risk versus benefit assessment of all of the possible options, including cannabis, and especially in legal states. And they're not doing that because they're fearful of Schedule I placement. They're fearful of losing federal funding if they accommodate cannabis patients for their organization. I mean, there's all these unwarranted fears. I mean, we have debunked, I don't know if you guys have heard of Ryan's Law, California, that passed last year, but part of the process of getting that to pass, its third year in, was getting a letter from federal CMS saying we've never withheld federal funding for an organization accommodating cannabis patients, and we never will. It's this perceived risk that there's going to be a ramification for allowing it. And that's really what we're facing. And I worked with a lot of patients who would go back to their doctor and they're weaning off their pharmaceuticals with better quality of life, better function. Then the doctors would reach out and say, okay, tell me more about this. I need to understand why this is happening. Because once they see it as an answer, you can kind of crack open that paradigm. And if they're ethical, they are open to this new information and they run with it.
A couple of things about teaching that in medical school. One is that they're averse to plant-based medicine. And the other thing is that I've gotten a greater understanding of how the human body works by practicing cannabinoid medicine for over 20 years. You begin to think about the connections in the brain. You begin to think about the neurotransmitters, things that aren't even touched on in medical school.
Yeah, I talk a lot about the approaches for autism, the FDA approved medications, the list of side effects, extrapyramidal symptoms, suicidal ideation, male breast development. I mean, their quality of life impairing and possibly life threatening. And this is still what doctors are doing for autism. And we also have research saying that autism is endocannabinoid, AKA anandamide deficiency, that it's a much safer option. The side effects are beneficial and euphoric, and yet it's controversial. It's like, let's look at this logically. And I've written an article and done lots of presentations. The title is Cannabis for Autism Harm Reduction. And I think we can write and speak about this and plug in just about any diagnosis. Cannabis for diabetes harm reduction, cannabis for cancer harm reduction, cannabis for fill in the blank mental health harm reduction.
Alzheimer's.
And scientifically cited and supported. So, I mean, thank you, Dr. Bierman, for your work as well. It sounds like you've been pioneering this even longer than we have. So
What was that again?
She said you've been pioneering this much longer than we have.
Yes, and I appreciate that compliment. And I also want to call out today's practitioners who are very much into the research. Of course, Dustin Sulak, Bonnie Goldstein, heard them give some presentations at a conference recently. And that's really impressive. And what's not impressive is that you don't have a lot of doctors that are listening to this kind of information. I mean, it's just mind-boggling.
Yeah, Bonnie Goldstein is one of my board members for my nonprofit Autism Safe Haven, which is committed to cannabis inclusive autism care resources, care homes, care communities, where the caregivers can administer the cannabis. What a concept. Harder than it sounds.
Yes, I use Bonnie's book. Her textbook is the main textbook in my class.
Yes.
Cannabis is medicine.
She just reached out and she has an education course as well. And I was encouraging her to reprint her book when she updates it and include the teaching materials. So nobody else has to recreate the wheel like you did, Janice.
Yes. Wouldn't that be nice?
Well, great talking with all of you.
Yes. Any last minute questions? Heather, Kayla, David?
I just say thank you for doing what you're doing. I fully agree that we need to share this information and education with more medical professionals. And I'm excited that you're reaching out to nurses because I think we're actually very well suited for this type of care for patients because it is patient-led and a holistic view of looking at folks, which is what our training has always been. So I'm on a mission as well to have cannabis accessible to every cancer patient, regardless of where they live. Because
Yes.
my parents were two of those cancer patients living in an illegal state and had to illegally access their medicine that thankfully kept my dad alive for an extra 5 years. So I have some pretty strong, I don't want to say opinions. They are my opinions, but also it's educated information that I'm really trying to be out there spreading for people. So I appreciate what you're doing. And I personally am going to be looking into kind of how my next year unfolds, because I think your program's a great option.
Great.
So yeah, thank
Love to
you.
have you. Thank you for your work, Heather.
Thanks.
See, like you guys are very passionate about it, and that's really important to me because where I'm a nurse and a medical marijuana patient as well. So I've decided that I'm going to sign up. You said that I could have the application in by the 15th. Like everything didn't have to come in. Like I think like the resume or the references. I think I can get everything in. It may take a little bit for my references letters, but yeah, I'm pretty much going to sign up because you guys convinced me after this call. I'm pretty
Great.
excited.
Great. Love to have you.
Look forward to it, Kayla. That'll be fun.
Yes. Thank you guys.
Yeah.
Thank you very much for inviting all of us.
Nice seeing you guys. Hope you have a good
All
night.
right. Take care,
Thanks.
everybody. Have a great night.
Bye-bye.
Bye-bye.